you. My name's Frances Seaslake and I'll be the nurse interviewing you today. So take a seat and lovely to meet you.
Lovely to meet you too, Franz. I'm Sally Tarr.
For a graduate nurse position, so that's terrific. And as you probably expect, we're going to ask you a few questions, so if you can just answer them as best as you can. Try not to be too nervous. We won't bite. We just want to get to know you a little bit better and to make sure that you're a good fit for us and that you'll be successful in our graduate nurse program here. So if I can just begin, would you mind telling us a little bit more about yourself and some of the qualities that you think you will bring to your nursing as a graduate nurse?
Hi, Francis. So before I start my nursing course, I have been working in different fields. I've been doing hospitality, telemarketing, human resources, logistics, and I also recently started to work in the aged care because I wanted to learn more about nursing. Lately I've been promoted as a medication endorsed team leader role, which I'm very happy about. So some of the quality I believe I can bring to nursing as a grad nurse is my analytical and critical thinking skills. I believe this skill is not only important in any job, but particularly important in the nursing profession, where nurses require a self-direct way of looking at things in order for them to interpret data, prioritize their patient, as well as resolving difficult clinical issue promptly and accurately.
May I also ask you why you want to work at our organisation? What was it that made you apply to our hospital?
I want to work for LinkedIn Health because LinkedIn Health deliver high patient quality care. They also recognize to provide very high standard teaching and educations. They not only care about their patient, but they also provide a very supportive environment for their staff in their learning and development. LinkedIn Health is also recognized as a center of excellence. They work with other health organizations and they're very successful in their research in areas such as cardiovascular and infection disease. So that's why I want to be a member of the LinkedIn Health team to develop my nursing skills and knowledge and contribute back to the community.
Thank you. Can I ask you what your particular interests are and what your... Sorry about that, that's my phone. What your particular nursing interests are and why you're interested in those areas?
Yeah, sure. I have a passion in mental health nursing because I enjoy talking to people, and mental health nursing provide me this opportunity to not only use my nursing skill and knowledge, but also use my communication skills in helping people who suffer from mental illnesses. And also I like mental health because I like the one-on-one time with the patient. I like to spend the time and listen to them, be there for them, and really, try to be in their shoes and understand them and help them in their recovery process.
Fantastic. Just a couple more. The other thing I'll be interested in knowing is a little bit more around how you deal with conflict, or if you've ever been in a conflict situation, that might be with a colleague or even a manager.
Yep.
How have you dealt with that situation? What's the sort of strategies that you use to manage conflict?
Yeah, I remember when I was working in as a logistic officer, my manager asked me and my work colleague to come up with some ideas to better manage the stocks in the warehouse. So what I did was I designed a new system using the Excel spreadsheet, and then I talked to my work partner about this idea, but she was not happy about it because she's not good with softwares and computers. So for many days at work, she was not very cooperative with me. She wasn't, working very well with me. She was quite upset. What I did was I approached her and invite her out for lunch. So we had an open discussion. That time we sit down, have a coffee and had a nice chat. Then I asked her about her opinion and her concern about the new ideas. And I listened to her carefully. And then after that, I clarify what she was saying and make sure that we both understand each other. And at the end, she allowed me to show her my new spreadsheet. I offered to show her how to use it. And after some time, she was more confident using the spreadsheet, and she was happy for me to propose this new idea to my manager. And the manager also was very happy about the new system and said that my idea did help the office to better track the stocks in the warehouse.
Okay, thank you very much. And finally, I'd like to ask you a clinical question, if I may.
Yeah.
So you're working on a general medical ward, and you have 5 patients under your care. 4 of those are in a ward situation, and 1 of them is actually being nursed in a private room with some infection control measures in place. You've just left that room, washed your hands, and all of the usual things, and you actually go in to help a 79-year-old gentleman transfer from bed to chair. He has a history of AMI, and he's complaining to you now. He's got chest pain, feels short of breath, and actually, as you're about to transfer him, collapses on the floor. Can you please talk us through your immediate response and your immediate clinical actions that you will take in the event that this occurred to you or during your shift?
Sure. So firstly, I will ensure the patient's safety. So if they're on the ground, just to make sure there's no object that might hurt them or wires that might trip the staff or hurt the patients. So ensure their safety is important. And then if the patient is conscious on the ground and able to speak in full sentence and reply to my questions, then I will perform a full set of observations on them, as well as using the PQRS pain assessment method to assess them. For example, ask them about the pain on their chest, whether it's radiating to other part of their bodies, and what the quality of the pain is like. And then I would move on and because they have a history of AMI, I will also do an ECG on the patient to see if there's any abnormality in the heart's rhythm. And then after that, I would closely monitor the patient. But in the event that if the patient collapses on the ground and they are not conscious, I'll just go back. So after the ECG, I will also look at the patient, and if my finding does show that my patient is having a heart attack, I will of course call the med team. But while waiting for the med team to arrive, I will give the patient oxygen via a Huston mask. So I will start with 5 liter and then monitor the saturation. If the saturation is not good, then is not better, then I will increase the oxygen level. And also I will check the medication chart. If the GNT is charted, I will also give that to the patient while waiting for the med team to arrive. But in the case if the patient collapses on the ground and they are unconscious, I will use my ABCD approach to assess the patient. So after checking that there's no danger, and after checking the patient is not responding, I will start on the A, which stands for checking the airway, make sure it's clear, the airway is clear, there's no obstruction. And then I will start on B, checking if the patient is breathing, listen to the breath sound. And then C, I will start my compression, 30 compression, and then 2 breaths through the mouth. And then D, I will use my defibrillator and follow the prompts while waiting for the med team to arrive. Thank you.
And thanks for coming in. And again, lovely to meet you, and all the best. We will be in touch within the next week, and then we will be able to let you know how it all went. Okay?
Thank you, Francis. Lovely to meet you. Thanks for the time.